So the first thing to think about when you're thinking about allergies, which unfortunately they're not really considering in most of the immunology textbooks and in most of the courses that go over allergy and immunology and this type of area of health, you want to consider the first couple of lines of defense. Excuse me. So the first line of defense really is the mucus and the saliva that's coming from the parotids and the sublingual glands and the different areas of the mouth that create saliva. And that saliva, when you chew your food and get it all over your food, it helps to break down any organisms and bacteria and funguses and parasites and whatnot that might be in your food. That's the first line of defense. The next line of defense would be the stomach. So you swallow the food, and then the food goes into the stomach, and the acid of the stomach should be low in order to kill off any of the microorganisms. Again, the microorganisms, things like bacteria, funguses, mold, yeast, spores, viruses, parasites, that kind of thing. So really, there's two main types of immunity. There's what's called Th1 immunity, which we'll talk about, and then there's Th2 immunity that we'll talk about. So why don't we kind of outline them here on the writing board, and then it'll just make things a little bit more clear. Okay, so Th1, which is cell-mediated immunity, and then Th2, which is humoral immunity. Okay. So we'll sort of break them up a little bit here. So again, Th1 is cell-mediated. And Th2 would be humoral immunity. Humoral immunity means that the chemicals that are needed to fight off antigens are foreign invaders, those chemicals come from the humors being the body fluids. So with about 85 to 90% of my patients, I'm actually checking to see if there's an imbalance in their body fluids and the majority of their visits into the office, maybe 60% of their visits or so. So body fluids are important. The cell-mediated immunity response would involve things like the macrophages, natural killer cells, helper T cells, cytotoxic T cells. So that's the type of thing involved in the cell-mediated immunity. So let's just kind of keep going here. Let's put in there cell-mediated. We got that. Let's put in macrophages. Okay. Good. NK means natural killer T cells. And then we have the helper T cells. Okay, I'm definitely oversimplifying this, right? Because we have a good 45, 55, 60 years of or more years of research that have been done, not just in the United States, but all over the world on immunology and the immune response. So I'm just making things as simple as I can for obvious reasons. Okay. And then there's the helper T cells, and there's cytotoxic T cells. Cytotoxic T cells. Where do the T cells come from? The T cells come from the thymus, glands, splenic tissue, the spleen. Spleen's over here. Okay. The thymus gland is over here. Okay. And then they come from lymph nodes. Lymph nodes are all over the body. Let me show you a couple of really famous lymph nodes here. Since you're watching, they're here. They're here, all up and down here. And we have some lymph nodes all around this area and over in where the clavicle is, both above and below the clavicle. Tons of lymph nodes here. Breast cancer is often caused by women who have used the wrong kind of deodorant for many, many years. This is just one cause. It's not the only cause, but it's a big one. And then that poor, that toxic deodorant causes these lymph nodes to get infected with toxins. They're called antigens. And then the body just can't handle the toxic load, and it's happened for so many years, and it's, it plays havoc on the body, and then a woman can have breast cancer from that happening. There's many causes of breast cancer. It's not funny, but that's just one of the many, many causes. And that's common, though. And there's other things that can cause these lymph nodes to get toxic besides toxic deodorant. But toxic deodorant is so easy to talk about. That's why I'm talking about it, because it's easy to understand that. Okay, let's talk a little bit more about the Th2 immunity. Okay, that's the humoral immunity. So that involves the complement system. Okay, so the complement system. It involves neutrophils. Neutrophils are a white blood cell. Most of these things are white blood cells that we're going over. B cells. And we have plasma cells. Okay, these are all white blood cells, right? Except for plasma cells. Could be a million things, but yeah, so these are all pretty much all white blood cells so far. Okay, so those are the that's a nice simple way of looking at two different types of immune responses. Now over here we have innate immunity, so the cell-mediated immunity. Well, actually, I shouldn't really say that. The complement system, the neutrophils, the macrophages, and the natural killer T cells, those are what are called innate immunity. So meaning the immune response is quick. It can happen right away within seconds or minutes. So, we're thinking like an IgE type response. That means hemoglobin E. That's a type of a protein that helps with the immune response. And then these down here, the helper T cells, cytotoxic T cells, B cells, and plasma cells, those are all involved with acquired immunity. Acquired immunity can take a couple days to take place. So I'm thinking like IgG responses or IgM responses. Those are other immunoglobulins, other types of proteins that are involved in that response, that immune response. So sometimes people are exposed to an allergen, well, commonly like wheat, for example, and it'll create an IgG response that can take several days to play itself out. In fact, a wheat allergy can last for 6 months, one allergic response. So, the body may not calm down from a wheat allergic response for an entire 6 months. That's why going to a healthcare provider is well trained and understands how this type of stuff works and has therapies to help is such a great idea. I'm that healthcare provider, thanks. Because we can get rid of the immune response immediately with the therapies that we do in the office. So that's a great positive attribute to these types of therapies. I had this one fellow for 13 years. He was 13 years old, and for 13 years he'd had discomfort and pain in his stomach right near where his belly button is. After one treatment, nobody else was able to help him. Well, they helped him a little bit after multiple treatments, but nobody else was able to help him right away. But after just one treatment in our office, he had most of his stomach discomfort go away right away. And I don't know why I'm pointing over here, but that was huge. So these therapies are magical. And unfortunately, they didn't quite, himself and his family didn't quite follow up with the lifestyle changes that we gave him when he left the office. So the stomach discomfort came back within just a couple days, but you know, we just continued to work on the lifestyle changes at that point. Good. So let's go over some nutrients that are involved with the Th1 response and some nutrients that are involved with the Th2 response. Okay, let's do that. So Th1. Remember Th1, that's the cell-mediated immunity. And then Th2. Okay, we'll just kind of, because everybody wants to know about, like, what do I do if I know I'm having this immune response? So that's what we're kind of implying. There's certain things that can be done about it. Try to give you a feeling of, like, you know, empowerment, right? That's the whole idea. So let's just kind of go over that a little bit. So I'm going to use a purple pen for this. Purple is, I like the color purple quite a bit. It's nice. I also like that movie, The Color Purple, with Whoopi Goldberg. That was a good movie. Okay, so with the Th1 response, we'll have things like astragalus that can help. That's a herb that helps with the immune system. And then we'll have things like echinacea. Mushrooms, you know, like shiitake mushroom and that kind of thing. And then there's a herb called Melissa officinalis. So Melissa officinalis can be a powerful Th1 stimulating herb. These are herbs that stimulate the Th1 pathway. Okay, let's go over here. Caffeine. Caffeine is not really an herb, but licorice. Licorice is an herb. Green tea. Green tea is an herb. Okay, so I'm laughing because there's a lot going on with this type of thinking that maybe I'll share with you because I think you should know about it. If you're out there in the public and you're going to see healthcare providers and they're helping out with the immune system and they already know about Th1 and Th2 dominance and they've already studied this type of stuff and they're helping you, and I just want to get to the bottom line of a few things and clear a few things up because there's so much misinformation in healthcare that it's just ridiculous. Okay, I mean, people are talking about acai juice and they're talking about you know, Tahitian noni, and they're talking about colloidal silver, and you can drink platinum now, and you can do this and that, and you can take a high dose of MSM. I mean, you can go up to 30-40 grams and not get so sick that you die, and books say it has the toxicity of water, and not meaning to confuse you, but I want you to get the truth here, okay? Let's not just go with things that sound cool that you could try at home and experiment with like you're some kind of lab rat. Let's look at the facts, okay? So these herbs, they're all every herb, every intervention, every chemical intervention has its place. Now, obviously, I'm not talking about emotional therapies, which is part of the triad of health, and I'm not talking about structural therapies like chiropractic, surgery is a structural therapy, acupuncture when they put the needles into the structure of the body, that's a structural therapy. Massage is moving around muscles, bones, joints, and it's great. It's structural therapy. Physical therapy is a structural therapy. I mentioned it, but I mean, how this applies to that, that's in other videos that came before this one, where I'm explaining the triad of health, who I am, what I do, and why I do what I do. I would go through those videos. It's already been 16 minutes. Let's try and really cut to the chase here. So astragalus is a great herb for people with adrenal dysfunction, and it actually builds tissue in the body. So it builds strength, endurance, stamina. I mean, it's great, and it's for the immune system. It'll help with cell-mediated immunity. It's just a great herb overall. I use it often with my patients. Often meaning, more so than things like mushrooms and green tea and caffeine and Melissa officinalis. So, I mean, that's what I mean by that. Okay, so echinacea, I use that all the time as well. I'll use it for both Th1 and Th2 responses. In fact, the Th1 and Th2 immune response can shift back and forth within a matter of days or less. So it's really kind of odd when people use this approach, but this is how a lot of us healthcare providers are trained, and this is something you might have seen somewhere. Maybe you haven't. Okay, so echinacea, I just use it all day long, every day, all the time for all kinds of people. I'm not really finding a lot of contraindications for echinacea. I'm not really finding that patients with thyroid disease can't take echinacea. I'm more finding the opposite, that they respond well to echinacea in most circumstances, most of the time, most patients, even with Hashimoto's. Graves' disease is tricky. You got to be really careful with all therapeutic input with a Graves patient. But Hashimoto's and the 6 different types of thyroid dysfunction, I mean, I can pretty much safely use echinacea with all of those except Graves' disease. Mushrooms, I almost never use mushrooms because oftentimes patients have a fungal infections. Mushrooms are a fungus, and then I'm like feeding the fungus. Often they'll have a greater immune response with the mushroom initially within the first 6 hours to 2 or 3 or 4 days, and then the mushrooms feed the fungus, and the fungus gets healthy, and that's a problem. So I think that's a simple enough way of putting it. If you don't like that way of explaining it, then I'm sorry, but that's the best I can do for now with the circumstances we have. Melissa officinalis, just don't use it. Okay. Caffeine, I don't suggest patients take caffeine or use caffeine. What do I mean by that? I mean, if they're already drinking caffeine and their body doesn't have a negative response, I don't necessarily have them stop drinking it. They can drink a cup of coffee in the morning, no problem, if they're doing okay with coffee most of the time. However, there are certain contraindications for coffee. Often patients who have thyroid disease or thyroid dysfunction just don't do well with coffee. They're exhausted, they need rest, and they need to heal, and they need more nutrients in their system. And caffeine depletes many, many, many different types of nutrients. So it's not an ideal substance for health. Whether you're overweight, underweight, good weight, whatever the case may be, it's not an ideal thing to use, but it's also not a problem necessarily for many people. And to the defense of caffeine, most coffees, for example, have tons of antioxidants in them. Antioxidants have all kinds of health benefits. People with poor circulation have their circulation improve with caffeine. I mean, yeah, I've heard about all this stuff. I know about all this. I'm aware. I'm educated, okay? But I don't like try to get people to drink coffee. I just find out about, how much they're drinking and try to see how it's affecting their health on an individual case-by-case basis. This is about treating individual people with custom-tailored programs, not with just a one-size-fits-all approach that other people might use. We want to figure out what's best for you, not what's best for the writing board or for 80% of my patients or 70% of my patients. I mean, who cares? Just let's figure out what's good for you. That all starts with an exam. Okay, licorice I use really often. It's not a tonic herb like astragalus. It's not an adaptogenic herb, I should say. Tonic to some extent, but it doesn't build tissue in the body. It really helps with adrenal dysfunction. It'll help protect the reticular formation in the brain stem. It'll help with the whole. I mean, it's just amazing. There's drawbacks with licorice though. Licorice can cause decreased hydrogen ions, and decreased hydrogen ions can lead to a poor pH balance. And when that happens, it's a little complex, but basically the sodium-potassium pump in the body doesn't work properly, and a person can end up with some high blood pressure. Okay, so it's pretty much contraindicated in people with high blood pressure. Caffeine, licorice, and green tea, right? They're contraindicated in people with high blood pressure. So we suggest people with high blood pressure not use caffeine, licorice, or green tea. It's not a good idea. Contraindication means don't do it. Bad idea, Okay. So, but licorice is great. So one of the ways to deal with the sodium-potassium pump becoming imbalanced, that then causes troubles with blood pressure, which is really due to the angiotensin-renin system that's related to renin that's released from the kidneys that leads to the release of aldosterone from the adrenal cortex, which causes the body to convert angiotensin 1 to angiotensin 2, which allows the sodium-potassium pump to work properly. That whole mechanism gets askew with certain things being introduced into the body incorrectly. And one of those things is a high-dose licorice, but that can be resolved by simply using potassium with the high-dose licorice. So it's okay to use high-dose licorice with potassium, or even over a long period of time. I almost never do that, but it could be done. It's just that a lot of healthcare providers are not aware of how all these things work, and they're really trying to help their patients, and they're doing a great job, but they end up giving unopposed licorice, meaning just licorice on its own without any potassium and at a high dose, and then the person ends up with edema, that meaning they're having a kidney problem. They have edema in the legs. They have edema. Leg edema tends to be a kidney condition. Swelling is what edema is, and wrist or hand swelling tends to be more of a heart condition. Not always, but oftentimes. So pitting edema, meaning when you stick your finger into the area and it leaves a mark, that's not good, and that happens with a lot of people, and that tends to be a little more often related to the kidneys, but not always. And with that type of thing, too much sodium would be contraindicated. So too much sodium, too much licorice, these are the types of things that cause high blood pressure. High blood pressure has to do with 1.1 million things, so too much to talk about here and now. We're trying to focus on allergies. Let's try to keep going and focus on allergies. Okay, green tea is the only one left. I only use green tea for the patients who are having adrenal. It's kind of like they're an adrenal failure. Their adrenal glands are weakened. They're having lots of adrenal symptoms. The adrenal glands are the stress glands on top of the kidneys, and they're having all these symptoms. And so what we do is to get their, it's kind of like using a car, like when your battery goes dead, you need to charge the battery, so you get like the battery cables, right? And you connect it to another car. So it's kind of like we're using the green tea as the battery cables, okay? And then we can just give them the green tea for maybe a week or two or 3 or 4 weeks, and then we take them off of it. Green tea is like speed. Yeah, it's got antioxidants in it and blah, 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 and that's great, but patients never do great with green tea over the long term. They sometimes respond well over just a couple weeks, or if it's in a formula with a lot of other different herbs or nutrients, they may respond well, but they just don't do well when they use green tea over a long period of time. They may think they're doing well, they may feel great. Meanwhile, it's depleting their adrenal glands. It's not strengthening their adrenal glands. So that's not cool. Meaning that's not a good thing. That's what I mean, is that it's not a good thing. So let's see if we can move on. We'll probably have a part 2 here of allergies.